Would we allow the security guard or the receptionist to come in and do your brain surgery? Why are we allowing the congressmen who have no expertise around health care whatsoever to make decisions? They have no idea about the practice of medicine or the economics of medicine.
Does anybody here think that drug companies are going to spend all this money developing a new drug that they can't make any money on? Who's going to do that? What do we have, Mother Teresa in the drug companies now? They're not. That doesn't happen. Mother Teresa was a fluke of nature. She was a freak of nature. It was great if we could all be like that, but they're doing it because they can make money. And if we don't do that, who does that for the rest of the world? They're all feeding off of us, are they not?
They are feeding off of us. But you know what? I practice medicine, and I've now seen medicine from the other side of the world where it's actually paid for. I've been working with some of the largest employers for the last 10 years where the dollar begins in the healthcare system. We talk about holding the insurance companies accountable. Well, guess what? The employers are the ones that should be keeping the insurance companies under control. Senator Baucus and nobody on Congress right now is mentioning what we need to do to help hold them accountable. You drive competition from where the dollar begins. This is the movie that we saw 20 years ago, which we all hated. But we cut Medicare, taxes go up. The insurance companies have to absorb some percentage of the uninsured. Before anybody has to pay any penalties for not being insured, the insurance company has got to absorb it. Well, guess what? Guess who's going to pay for that? The consumers, you and I, and the doctors. What ultimately happens is that we compromise. What we compromised 20 years ago is care. The quality of care goes down, and this is the backhanded approach to how we ultimately get to a public option.